everybody being on time today. It makes it so much easier. Thank you very much. So we have 2 weeks to cover. We have last week to cover because we were taking the exam. Pregnant adolescents, it's the special vulnerable populations, LGBTQ, mental illness, alcohol, tobacco, other drugs. And then this week, hospice and palliative care, death and dying, faith and spirituality, and ethics. So a lot of content to cover. So we'll go through a couple of PowerPoints. I'll go through my notes that I have, and we'll try and go through the important education pieces in each concept that you need to know to understand the concept. And then we'll review the quiz after. The only housekeeping things I want to say, two things. One is about the book. This is a particular week, or these 2 weeks are particular weeks that there are full chapters in the books that you have to read, right? And you know there's a full chapter because you get the PowerPoint, right? Not the PowerPoints I send you, the PowerPoints that are uploaded in your modules, right? You know what I'm talking about, right? I said this at the beginning. If you have chunk pages out of chapters, you're not going to get the full PowerPoint in the reading tab of your module, right? But if you have full chapters, you are going to get the PowerPoint. And PowerPoints, as we talked about, are snapshots. They're snapshots of the chapter. And this is what I told my RN group last week. So, because the RNs have the full community books, so they always have chapters, full chapters. But I noticed when I was preparing and reviewing, there were a lot of chapter PowerPoints for you guys the last 2 weeks that we'll cover. Here's what you need to do. Here's how I would attack the chapters. Okay? Read the objectives. Read the objectives in the chapters. After reviewing the chapter, if you can answer those questions, the objectives are right at the beginning of the chapter. Okay, there's usually between 5 and 8. If you can answer those questions after reading the chapter, you're in good shape. But that's what you should focus on when you have those chapter PowerPoints. Okay? Get in the chapter, look at the objectives, and you can skip around the chapter to find the answers of where the answers are to those particular objectives. But if you can answer the objectives to the chapter, you're good. Does that make sense?
Yes.
That's what I would do. I mean, yes, you're technically responsible for the whole chapter, but those objectives bring out the important things you need to know about understanding the concept. And the concept is, what's the chapter? That's what's being covered. Okay? That's one thing. Second thing is exam 1. Most of you did very well on exam 1. There are some of you I know that did not get the grade that you expected. Okay? But I want to congratulate all of you that did well. Okay? Well done. Well done. I'm not sure if it's a combination of attending live reviews, listening to recordings, reviewing building your study guide that we give you at the beginning of, for example, I sent you last week 2 study guide. So you now have the week 2 study guide for weeks 4, 5, and 6. Okay. So whatever you did to prepare, congratulations. Okay. Anybody that's below a 78 in the exam really does need to meet with me. Okay. We need to go through the concepts you missed. Anybody over 78, I met with a student yesterday afternoon that had an 88 and she wanted to know the 6 questions she got wrong. Fine. So anybody that has above a 78, I'm more than happy to meet with you as well. Okay. But I really need to meet with students that were below a 78, right? Because not only do we do exam review, but we try and pick up areas in questions that might have been missed. Was it select all and apply questions? Was it specific words like priority words in a question that you missed? So not only do I do exam review, but we try and do some test prep strategies or refocusing. So anyway, I have heard from a lot of students already. I have lots of tutoring sessions scheduled this week, but there are students that I have not heard from, and you know who you are, and you need to reach out to me. I believe it does help to review what you missed because going forward, this class it builds upon previous concepts, right? And then the HESI, of course, is about it all, about everything, all the concepts. Okay. Anybody have any questions about that? Did I talk to you guys last week about at-risk meetings? Yes? No? Yes or no?
No.
Okay, so faculty have what's called at-risk meetings, where if we have students, and goes for every faculty member, if we have students that are at risk defined KGA below 78, exam scores below 78, attendance issues, homework issues, any other kind of issues, we are required on a weekly basis to fill out an at-risk report. And it gets sent to your deans. Okay. And I give you a heads up because if your deans reach out to you, it's not me tattletaling on you. We're required to do this. Okay. Then every other week we have campus meetings where the online meets with the on-ground staff. So your campus dean, every other week we meet with, and it's a big group. We cover all the classes, all the students. Okay, it's not just this class, it's every class, all the students. And we talk about our at-risk students. Okay, so so we have certain amount of meetings. They started last week, so we had certain campuses last week, the rest this week, and then it's on a rotating basis. So we end up meeting face to face with campuses every other week. Okay, so some of you, obviously, I have at-risk forms filled out for you. You know who you are. So I just don't want you to be surprised if your campus dean reaches out and said, "I see you got a low grade on exam one, and your professor also notes that she's waiting to hear from you to schedule a meeting. So please reach out to her." I had several emails this morning from students that I think that's exactly what happened. Hey, can we meet? Because I'm sure the dean's got the at-risk reports over the weekend and are reaching out to students. So I just don't want you to be surprised. If your dean approaches you and talks to you about something and you're thinking, how'd they know that? These are these at-risk reports that we are required to fill out. Okay. So just that's for clarification. Okay, so before we do anything, let's go ahead and take quiz 3. All right, because it is timed for 15 minutes, and I think I have it shut off at 3:30. It goes on at 3 o'clock, goes off at 3:30. So we still have plenty of time. So I have I have a couple students in this class that have accommodations, so they have a little bit of extra time. So it looks like it's about 3:09. You should be able to get into exam 3. It's the same passcode as the last two. My last name, Marvel. And I'm going to put that in the chat. Does everybody see a Kahoot in the chat? Yes, no? Hello? Can anybody see a Kahoot link I put in the chat?
No, I don't see it. I just see
Okay,
with your last name.
yeah, I think, you know what, everybody's in here, so I'm just going to copy it. All right, there's going to be a Kahoot link. Hopefully we'll get to it. I want to do this Kahoot link. Let me know if you can see it now. You see it now?
Yes.
Okay, great.
Yes.
I think if you haven't checked in yet, you can't see what was behind. So anyway, it's there. So go ahead and start exam quiz 3. I'm going to mute. Let's come back. It's 3:10. Be back here by 3:30. Okay. And that's because I have to accommodation students. All right. Don't log off. You got to stay on camera. When you finish, you can turn the camera off if you want, but we will start again at 3:30. Okay. I'm going to mute myself.
No, I'm still on mute. She's on there, but oh Jesus, man, I'm not even paying attention to things. I'm sick of this shit.
Couture.
You're not on mute, baby.
Oh. Sorry, class. I'm sorry. So sorry.
Okay, looks like everybody's done. If everybody could go back on camera, that'd be great. How'd you do? I have a
Terrible.
thumbs up from Clarinda.
Mm-mm.
You guys are awful quiet. Okay, let's review the quiz. And then we'll go through some content. What did you think about the quiz? Did it cover a good variety of topics from weeks 4 and 5? What?
It did. What?
Okay. All right, I'm gonna share my screen. Let's go through it. Can you see my screen?
Yes.
Okay. Okay. So, school nurses engaging in primary prevention, which intervention is appropriate? Let's review what's primary, secondary, and tertiary. What's primary?
Prevent it from happening.
Correct. Somebody else answer. What's secondary?
Screening.
Screening. Okay, somebody else answer. What's tertiary?
Treatment.
Treatment. Managing whatever you have. What's the right answer here?
A.
To discuss where and how to obtain the contraceptive.
Correct. Right? Preventative. Right? What is A?
I guess it's screening now. I thought it was
Screening. Well, they need to get a pregnancy test. So they're
Yeah.
at risk for pregnancy, right?
Yes.
What's C?
Is
Somebody
it
else. I don't want to
tertiary?
start. I need everybody to participate. Everybody. So I don't want to start calling on people, but I will. I have the same people participating. So
Tertiary? Tertiary, it's tertiary is
Tertiary,
number 3.
the third one.
yeah, they have a condition, correct? And what is D?
Primary.
Nope.
Secondary.
Secondary, like the appropriate diet. No.
It would be treatment because she would already be pregnant if they're creating a
Bingo.
pamphlet.
Right.
Okay.
She's already on a prenatal diet. So what does that mean?
She's
She's
pregnant.
already pregnant.
Pregnant. Yes. So it's tertiary. So there's a good example. Remember, I told you don't get caught up with education just being in primary. There's a good example of education being in the tertiary level, right? Creating a pamphlet. You're educating on appropriate diet. Does anybody have any questions about any of those primary, secondary, tertiary answers? Okay, which counseling is appropriate to provide the pregnant adolescent? What's the right answer here?
Hey,
A.
Right. Right? We know that we do want to teach them to use condoms during sexual contact, even during pregnancy, right? To prevent STDs. Why is B wrong?
Because you don't
'Cause it
want them
says
to maintain
without.
the usual diet. You actually need to change the diet.
Right, you
to-
actually do need to change, right, right. Why is C wrong?
Prenatal care can be a certain section.
Prenatal care should start when you find out, because neglecting to have prenatal care is the
Right.
babies get at risk for a lot of things. Not
Correct.
developing co-feeling.
Correct, Katura, thank you. And then, why is D wrong?
Because maybe she doesn't want to put the baby up for adoption.
That's one, what else?
Because
Giving her an
adoption can be
option.
discussed throughout the pregnancy.
Go ahead, Clarinda.
Adoption can be discussed.
What? Clarinda, say that again.
Because adoption can be discussed throughout the pregnancy.
Exactly, there's no rush for that discussion, right? Good job, you guys, good job. Okay, which intervention should be prioritized for a child who has witnessed a violent crime? So if you use it, this is an exam question using your highlighter, there's a lot of information in this short question. What would you highlight?
Prioritize.
Prioritize.
Okay,
How about violent crime?
violent crime, sure. Prioritize violent crime. Okay, so what's the right answer here? Well, actually, yep, that's the right answer. C, obtain referral for mental health counseling and services. So this is a good example of a question. I've talked about this before, but I'll talk about it again because in the reviews I've done, this has already come up, right? So there's several answers that at first glance could be correct, right? But it's not a select all that applies. So there's only one answer you can pick. So go back to the question and read to see if you missed something. You might have missed the word prioritize. Okay. What's the right answer? C, we talked about that. Obtain a referral for mental health counseling and services. So that's pretty much the standard, right? It's the standard to start with that. That's a priority, right? You also, after you have obtained that referral, A could be appropriate, B could be appropriate, D could be appropriate, but it's asking you to prioritize what's the most important thing to do. First and foremost, obtain a referral. Okay, does that make sense? Okay, which nursing intervention reflects secondary prevention for mental health? What's the right answer here?
A.
Screening. Everybody get that? Hopefully everybody got this one right. What is, Charmaine, why are you laughing?
I'm like, yeah, finally.
What is B?
Tertiary?
Or
Oh,
Primary?
no.
Primary. Right? It doesn't say that they have something yet. So we're going to try and proactively teach them stress reduction techniques. Right? That sounds like a pretty good plan, doesn't it? What's C?
Tertiary?
Because
They already have been diagnosed with something.
Yep.
The person.
and then what about D? What's D?
Tertiary.
wait, that's like make sure you read real depth.
Pardon me? We already have somebody with PTSD. Good job. Which nursing assessment is the most important for clients abusing oxycodone?
Apnea.
Right. Why is that, Brian? Why is that the most important?
Well, if you can't breathe, you ain't alive.
Couldn't have said it better myself, right? This is a safety question. This is an ABC question, right? Safety. It's not that these other ones it's not that these you wouldn't observe these other ones, but it's asking what is the most important. So apnea would be the most important. Okay, number 6. Okay, now we have a tertiary question. Which reflects tertiary prevention in substance abuse?
Arranging
Arranging
addictive support
outlet-
groups to promote recovery.
Right.
Mhm.
Right? Because that says that you're already working with people that may be addicted. What's A?
Secondary,
Secondary.
Screening. What's B?
would that be secondary?
Primary.
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 Nothing's diagnosed yet. We're just providing information. Right? Trying to prevent something before it happens. What about D? What's D?
Tertiary,
Primary.
Primary. Doesn't say anybody has anything, right? We're just trying to teach parents how to be good role models. Right? Hey, which nursing intervention reflects non-malfeasance? What is the difference between non-malfeasance and beneficence? Those are two ethical principles. What are they? What's non-malfeasance?
non-malfeasant is doing
To
something.
do no harm.
intentionally
To do no
harm. Okay,
Do no harm.
right.
And what's beneficence? Do good,
Do good.
right? So we're asking, so what is an example here of non-malfeasance?
Inserting
A.
into to administer meds in a client who can swallow.
No.
No,
Okay, let's go back to Charmaine. She just said B, inserting, okay, Charmaine, if you insert a feeding tube inserting a feeding tube to administer meds in a client who swallows normally, that's okay, right?
no,
Why not?
not because they can swallow. That's like torture.
Okay, all right. Okay, let's go to the correct answer first and then we'll answer the other ones.
Okay.
A is the correct answer. Okay. Which nursing intervention reflects non-malfeasance? That means what corrective action was taken when something was potentially going to cause harm. So apparently in A, when they tried to do a catheterization, the sterile field was contaminated. So what did they do? Obtained a new kit. Do no harm. The rest of them do harm. Right? Why would you need to insert a feeding tube into somebody who swallows normally?
You wouldn't.
Why would you fail to document side effects of a medication? You wouldn't. Why would you fail to maintain confidentiality about one of your coworkers who may be working under the influence? B, C, and D are all examples of doing harm. Right? You guys understand that? Where A is an example of a corrective action to do no harm.
I missed the word after contamination.
Okay, question 8. Hospice nurse notes the client's pain is poorly controlled despite the fentanyl patch and as needed sublingual morphine. Which intervention is appropriate? There's a lot of information in this question.
Hmm,
What would you highlight? Who is the patient? What kind of patient are you taking care of?
A
Hospice.
hospice patient.
Hospice.
Mhm.
Okay, so then we have to think in terms of hospice patients. Okay, now they have a poorly, whatever they have prescribed is not working. Okay, we're taking care of a hospice patient, so we have to think about what's important. What's the
Pain.
correct answer?
Pain,
Notify the healthcare
healthcare
provider of
provider
the need
need
for additional.
additional medication.
Exactly. Right? Because what are we striving for in taking care of hospice patients?
Pain
Keep
control.
them comfortable and
Comfortable. Exactly. Exactly. We're not worried about, so add non-pharmacological pain management to avoid the risk of addiction. Are we concerned about addiction with hospice patients?
No.
No. Right? Counsel the client and family that a pain-free death should not be expected. No, we wouldn't do that because we are trying to provide a pain-free, right? Or as comfortable as possible. Why is D wrong? This is a med surg question.
It doesn't matter where you move the fentanyl patch. You
Just be
supposed to
put
move
new
it,
one in
but
the same
that's
location.
not what they're trying to do.
Hear what Brian just said. Go ahead and repeat that, Brian.
If you remove a fentanyl patch and you replace it and you put it in the exact same location, you could overdose the patient and kill them.
Yep. Okay. This question always brings up discussion. The client tells a hospice nurse that I do not understand why God is punishing me. Which response is appropriate? Okay. What's the right answer here?
Do you have a pastor I can call for you?
Exactly. That is the right answer. Okay. A lot of students will pick D, right? Because they think about that therapeutic communication, acknowledging what they're saying, but we're in a different patient care situation now. Okay. You, as the hospice nurse, are probably not in a position to have this conversation, this spiritual conversation with your hospice client. Now, it may be different if you're a faith community nurse and you've had all this additional training in spiritual care, but it doesn't say that. This is a hospice nurse. Okay, it's not a faith-based nurse that may have the additional education. So the reason why B is the right answer, I can see why people would select D, but not for this particular situation. Okay, we certainly wouldn't say A, because then we're acknowledging that they're being punished. We're agreeing with them kind of that they're being punished.
Right.
So what we would never pray for forgiveness because we wouldn't. Do you have a pastor I can call for you? That's the most appropriate, right? We would never say C. Dying is just a normal part of life. It's not punishment. Who are we to say that? Right? The other explanation I always talk about with D is what makes you think you're being punished. The other reason why that's not a correct answer is then you're asking them to actually articulate what maybe negative things are going on that are bothering them, that they feel like they're being punished. Is this really the time to have them explain to you why they feel like they're being punished? Probably not. Does that make sense?
Mhm.
Anybody have any questions about that? Okay. Last question. Client with metastatic breast cancer has made the decision to stop all cancer therapies. Which statement by the nurse reflects a respect for the client's autonomy? So we talk about our content here. We'll talk about how important autonomy is for the dying patient. They don't have a lot of decisions left to make. We want to give them as much autonomy as possible. What statement reflects autonomy?
A,
A. All right, B is not appropriate. Let me see if the physician can talk to you about the benefits of radiation. Right? She's already decided she's going to stop all therapy. So why do we want to bring somebody in to talk to her about radiation? Number C, who are we to question if this is the best decision or not? It's not up to us. Right? And D, again, she's already decided she's going to stop all treatment. So why would we talk to her about chemo? Okay. So does that help? Does that help going through the quiz like that for the questions you got wrong?
yes, it makes critical thinking a little bit more broader.
Yep. And remember, it talks about clinical, or taking our knowledge and putting it into patient care. Right? Does anybody have any questions about the quiz? Okay. I'm going to pull up I'm going to bounce back and forth between my PowerPoint. Let me get this open here. Week 4. And I'm also going to get open. Can you see that?
Yes.
Okay, and I'm going to also open my notes here. So I want to make sure. I usually have a second screen that I can put these notes on, but I don't have my second screen with me because I had to go find someplace else to teach, so I missed my second screen. All right, so I'm going to bounce back between. So week 4, we covered special vulnerable populations. You had readings in the book. The Canvas readings for week 4 are good readings. Pregnancy, LGBTQ, and I think it was mental illness. Really good Canvas readings. So this is what we're covering. Let's talk about pregnant adolescents for a minute. Okay, what challenges do pregnant teens face? Hello? What challenges do pregnant teens face?
They face the challenges of not, getting the proper nutritional, yeah,
Yep.
Needs, because they're so young, finances, education, things of that nature.
Yep. What else? Who wants to add to that?
Dropping out of school.
Not a school.
There are risk of domestic violence too if they are in the
Very high risk of domestic violence. Yep. What else?
Did it say about the peer pressure or not being able to like live a normal teen life because they're pregnant and they feel like they don't fit no more because they're pregnant?
Yep.
Full-time labor.
What about their at their developmental stage? They're in a bit of denial as well, right? They may not even want to acknowledge they're pregnant. Right? Maybe hiding it from their family, thinking it will go away. Right? What other challenges do they face? Maybe their family doesn't accept that they're pregnant. What else do they face? Economic challenges, school challenges. They typically drop out of school, right?
They high risk.
They can be high risk.
Their
They may,
environment,
go ahead.
Transmitted diseases, poverty, housing,
Yep.
drugs, alcohol.
And trauma,
Abs- What, Brian?
abuse and trauma.
Yep.
They're at risk for abuse and trauma.
Absolutely. Let's take that one step further. What about pregnant homeless teens? Have several challenges as well, in addition to everything we talked about. Higher risk for
There's higher
STIs.
risk for sexually
diseases,
transmitted diseases,
addiction to
drug
drugs,
dependence and
alcohol.
abuse.
Yeah. Drug issues, drug dependence, alcohol, poor nutrition,
Low birth rates, poor birth outcomes.
maybe challenging birth outcomes, premature, miscarriages, stillborns, low birth weight babies. And in your readings, what did you find that the nutritional needs are? What are the additional nutritional needs for pregnant adolescents?
They need three
They typically don't have good diets, right?
they need to incorporate folic acid in
What do
their
they
diet.
need?
Folic acid and iron.
Iron.
Exactly. Yeah. Okay, so let's say you're the home health nurse and you are, or you're the faith nurse, and one of your jobs is to go in and visit new moms, new teen moms after they've had the baby. In your visit, what would you, what do you want to see that's positive, and what red flags, what might you pick up on? So let's start with the positive. What would you like to see with a teen mom?
Bonding with the
That she
baby.
has good knowledge about growth and development of the baby.
Yep. She knows she can identify what the baby's needs are, maybe when the baby's crying. Bonding, what does bonding look like? Maybe eye contact. Being able to meet the baby's needs. What would you be concerned about? What other things would you observe in the house when you're doing a visit with the teen mom?
Does she have what she need to provide for the baby? The nutrition, the environment for the baby. Does she have someone to help her?
What does the environment look like? Does she have support? Does she have supplies? Is the dad involved or not involved? What does the environment look like? Or is it a supportive environment? Is it a chaotic environment? How's everybody getting along with each other? Is it a calm environment? Is it a loud, argumentative environment? Lots of risks for teen moms, right? And you as the home health nurse are going to be assessing all. You're going to be assessing the mother. You're going to be assessing the baby. You're going to be assessing the family situation. Do things look intact? Do they look right, or do they not feel right? Hey, are there other kids in the house? Are there other kids in the house? Are they getting attended to? Big focus in community nursing on teen pregnancy and then teen moms. Okay, let's talk about LGBTQ population. One of the things, and this is the beginning of the conversation, I will start with working with vulnerable populations, and I may have already mentioned it in previous weeks, but I'm going to bring it up again. When we're working with vulnerable populations, we need to be sensitive to our own feelings. Whether we're working with the homeless, we're working with teen pregnant, we're working with LGBTQ, we're working with substance abuse, we're working with victims of violence or perpetrators of violence. We're working with people with schizophrenia, mental disorders. We have to have an understanding of our own feelings. Okay, do we have biases towards a particular population? Do we have prejudices? Right? Are we able to competently care for all these vulnerable populations? Because if we can't, if our own thought process is preventing us from providing culturally and competent care, then we shouldn't be caring for these populations. Would you all agree?
Yes.
Mhm.
I mean, you're gonna, in working in the community, we've already talked about, you're gonna face and work with a lot of vulnerable populations. Okay, so got to get yourself in check first. Okay, so one of the things with the LGBTQ families, the second bullet, understanding your own feelings. Okay, one of the things we should be able to do, we need to do, is provide a safe environment for the LGBTQ clients to be able to talk about what's going on, being non-judgmental. You know, we talk about asking questions like, so for example, for an LGBTQ, we may not say, do you have a husband or do you have a wife? We may say, do you have a partner? Right? You can't assume heterosexuality. You have to ask open-ended, non-judgmental questions, right? Providing them a safe environment to talk about what they're coming to seek care for. Okay. One of the things to know about CDC recommendations for this particular population, they have the screenings. You read about these. Okay. STIs, HIV, gonorrhea, herpes, chlamydia, and syphilis. What did you read? How often are these screened for?
Those are screened annually.
Annually.
Annually, unless there's high risk, and then it's 3 to 6 months.
Exactly. But Brian, what is the typical recommendation? Annual, correct?
Annual.
Annual.
Yeah, annual. Okay, so if they are at higher risk, that interval changes to 3 to 6 months. There's two reasons. What are the two reasons that put them at higher risk?
Multiple sex partners.
Partners.
And those that have
Illicit drugs.
Drug use.
Hang on. Go ahead, Maria.
Drug
Maria.
use.
If they are in the multiple sexual partners,
Yeah.
and then if they are in the illicit drugs.
Yep. Okay. Mental illness. There's lots of people with different mental illnesses. The increase is exponential of mental illness diagnoses. Anxiety, depression. Okay, again, anxiety in care of patients with mental illness. This is very sensitive. We need to be able to care for these clients competently. What's general anxiety disorder?
person experiencing persistent, unrealistic, and excessive worry about 2 or more life circumstances of 6 months or
Yeah.
longer.
So general anxiety, you worry about a bunch of things at the same time over a long period of time. Phobia, what's a phobia?
Irrational fear of a specific activity, situation, or object.
Okay. Somebody else answer, what's OCD? Sorry, Charmaine. You'd answer every question for us. And all your teammates are going, go, Charmaine, go. Go, Charmaine, go, because they don't have to do anything. So I need somebody other than Charmaine to answer the next question. What's OCD?
A recurrent or intrusive thoughts that they cannot stop thinking about, and those thoughts create anxiety.
You're gonna have exam questions on exam 2 about all of these. Okay, why are kids at highest risk for mental illnesses? Somebody other than Charmaine and Maria. Who else? Why are kids at high risk? This is
Because of
all
their environment that they come up in. Kids like mimic what they see, and it kind of sometimes traumatize them. Maybe, I don't know.
Yeah, no, that's a good start. What else? That's great.
Because they don't have the same capabilities as an adult to cope with different situations such as stress, anxiety, or life events.
Yeah, that's perfect. So let's add to what Brian said and Katura said. To give us one more reason.
Could it be because of death, trauma, that they experience through, you know, the household or environment?
Yep.
environment?
Yeah, what if their role models are violent? What if their role models are not good role models? Right? And they learn that there's only certain ways to deal with stress. Maybe hitting, punching, bullying. That's where all your issues come in at school, right? With harassment, bullying. Okay. The one medication I want you to know about is lithium. You're going to get asked about in the next exam. Okay. What is lithium used to treat?
Bipolar.
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 And I've outlined the teaching. Encourage normal salt intake, report diarrhea, report vomiting, tremors, lack of coordination. So if I'm sharing that with you, what kind of question might you get asked on the exam?
What are negative side effects of lithium?
Be more specific. What I'm giving you a teaching plan. What are we going to teach? We have a new patient who's on lithium, a patient who's newly on lithium. What are we going to teach them?
What to avoid?
Well, we're going to teach them what I just shared with you. Encourage normal salt intake, report diarrhea, report vomiting, tremors, lack of coordination. Okay? Alcohol, tobacco, and other drug problems. Substance abuse contributes to teen pregnancies. We definitely know that, right? We know it contributes to STIs, and we know it contributes to domestic violence. That's for starters, right? Substance abuse contributes to a lot, right? Substance abuse in teens, substance abuse in adults, substance abuse in the elderly. Okay. I want you to read up, if you already haven't, on tobacco use. What diseases does it contribute to? Lots of different respiratory diseases. What do we think are contributing factors to substance abuse? I'll start. Maybe unemployment. What else?
Poverty.
Poverty. Huge. What else?
Nursing school.
Good one. Nursing school. Well, you know what? Anybody with substance abuse issues, if you go back, it's probably for a variety of reasons. Could be divorce, could be death, could be peer pressure, right? Could be anything, right? Why do we think people use drugs? Kind of the same kind of question. Why do they use drugs? They are in a compromise. Go ahead.
Coping.
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 Coping. They're in a compromised state. Okay. Please know the difference between these terms. Okay, they're in your readings. Okay, substance abuse, drug dependence, withdrawal, detox. I'm not going to go through each one. Drug addiction, polysubstance abuse, and alcoholism. Okay, you're going to get asked about this. Maybe given a scenario, right? And which term is, so just, I would just, in your notes, when you go to take your notes, just write a little one sentence about each one of these. Okay, because there is differences between them. Okay, the other thing is we have a lot of drug specifics. We have depressants, stimulants, energy drinks, tobacco, vaping, alcohol, cocaine, and amphetamines and methamphetamines. please be able to give an example of each one. What is a depressant? What's a stimulant? Right? Then also look at like we had a quiz question. Right? I would like for you to know what a client might present with that maybe has an overdose of alcohol, overdose of cocaine, overdose of amphetamines or methamphetamines. What might a client present with? So you need to do your research if you already have it. It's all in your readings. Okay. And then the last thing about alcohol, tobacco, and other drugs is it's important to know about community-based activities that people or groups or organizations do in the communities for substance abuse prevention. Some examples are school activities. I did a lot of school activities when I was in school nursing about education with substance abuse prevention. Student assistance programs. I did a lot of education with parents on substance abuse prevention, what to look for. Recreational activity involvement, after school activities, community activities to get kids involved with, to keep them busy. Parents not allowing drinking in their home. Anti-peer pressure skills, really important. And then general health screenings for alcohol, tobacco, and other drug. That's what those, early on when I talked about secondary screening in the schools, we did a lot of general health screening for alcohol, tobacco, and other drugs, behavioral health issues. Who's at risk for alcohol use? Who's at risk for drug use? Who's at risk for suicide? Who's at risk for bullying, harassing? Okay. Questions about any of those topics? Let's talk about this week's concepts. Hospital palliative care, death and dying, always a hard topic to talk about. Faith and spirituality and culture and how that weaves into our nursing care. Faith community nurse, ethics, and the American Nurses Association. Okay, what is the difference between hospice and palliative care? What's hospice care?
Hospice is to keep the clients comfortable, maintain dignity and self-esteem.
When?
End of life care.
End of
End of life. End
Mhm.
of life. Palliative care. It's part of hospice care, but what is palliative care?
Trying to give them the best quality of life possible.
For what they have left,
Yes.
right? So let's say I was diagnosed with a cancer today and they've given me a year to live. Palliative care is, what does that year look like? Right? How can we plan for maintaining quality and maintaining my life as normal as possible until we have to move into the hospice stage, which may be in 10 months or 11 months.
Without attempting a cure.
Does that make sense?
Mm-hmm.
There's a lot of similarities, but that's the one main difference. Palliative care can go on for months. Okay? So as Charmaine said, keeping the patient comfortable and maintaining dignity and self-esteem. Most important for pain control. However, we don't want to give so much pain medication that the patient is out of it, right? During this time, we want them to be able to enjoy family, enjoy conversations, talk about things that they want to talk about and not be a zombie from all the medication. This happened with my husband's mother a couple of years ago when she was in hospice. And we weren't in Chicago. Anyway, she was way over medicated. She was out of it. Every time we went to visit, she was out of it. So myself and another daughter-in-law who were nurses talked with the hospice nurse and said, this is not the way it's supposed to be done. You know, she backed off and anyway, within a couple of days, she started to be a little bit more awake and alert and could carry on conversations. And it was so meaningful to her 5 boys that she could actually, nobody wanted to come and visit because for months, she wasn't even awake. So anyway, it was sad, but that's not what you want to happen, right? You want to try and give them as much comfort, but yet let them engage in their care. And autonomy is important in end of life care. We want patients and families to be able to participate in as much decision making. You want the client to be able to really outline, how do you want hospice care to go? What's important to you? What's not important to you? You know, do you want a feeding tube? Do you not want a feeding tube? Those kinds of things, right? So we want the hospice palliative patients to be interacting with family, right? Of course, the goal is to alleviate pain, but you have to find a comfortable medium. Hospice nurses does anybody ever worked with a hospice nurse, with a family member, or in the hospital setting?
Yes.
Oh, anybody else besides Charmaine?
Yes.
Hospice nurses are just, they're just one of a kind. They really are. One of the things that hospice patients and families need to understand is when you're in hospice, palliative care, there is no cure, right? It was like one of our quiz questions, where the patient said, I'm going to stop all treatments, or, you know, or maybe that was in your readings, where the patient says, I don't want any more treatments if it's not going to cure me. Well, what do we have to do? We have to educate them. There is no cure when we're in hospice care, right? We need to try and humanize that death, right? And also in hospice and palliative care, aggressive treatments are all stopped at that point. Okay. So where do we provide hospice care? It can be provided at home, in long-term care facilities, maybe in small clinics and hospitals, hospice centers. 6 months to live if all treatments are stopped. This is the definition of hospice care. I want you to review the stages of grief. You will be asked about this on the next exam. Okay, where maybe a family member is verbalizing this. What stage of grief are they in? Is it the denial stage? Is it the anger, bargaining, depression, acceptance? And one of the challenges for the hospice nurse is that the client and family members may all be in different stages of grief, right? How do you help family members at different stages of grief? Maybe there's kids involved, younger kids involved. Younger kids deal with grief differently than teenage kids or adults or elderly, all right? So really take a look at your stages of grief, right? Always using therapeutic communication, open-ended questions, right? We're not worried about addiction. We already talked about that. You know, maybe it's up to the client if they can participate. Maybe it's a combination of pharmacological and non-pharmacological treatment for pain management. And as Brian said, palliative care is improving the quality of life, trying to alleviate suffering, improving suffering, and for them to improve to the best that they can, to go through this palliative stage until they get to hospice. Okay. Faith and spirituality and cultural. So cultural competence is one of the foundations of our nursing profession. All right. I'll say it again. Cultural competence, understanding our own culture and biases. So yes, we talked about the vulnerable populations, but this also comes into caring for any of our clients. Think about culture now, not just the vulnerable populations, now different cultures. Do you have any biases against certain cultures? I don't know. But if you do, you gotta sort that out, because in nursing, wherever you're gonna be working, you're gonna be caring for lots of different clients from different cultures. We need to be able to understand their beliefs, their values, their practices, try and incorporate as much of their culture into the plan of care. Right? We know that every individual is unique. Every culture is unique. There's no common minority. Okay. We also know that cultures have different focuses on past, present, and future as far as their orientation. Some cultures focused on past. They're so focused on the past that they don't really think about the future. And that has its ups and its downs. Then you have the present. Cultures that are present, they're focused on the here and the now. They don't care about what happened in the past. They're not even thinking about the future. And that can be good and bad as well, failing to plan for the future if you're so present focused. They're just focused on today. And then you have the future oriented cultures that all they think about is the future. They're not even thinking about what's happening today or what's happening in the past. Okay, so read about, that's in your reading. Read about the difference between past, present, and future focuses for different cultures. Okay? Over my 40 years of nursing, I've slowly learned about cultures, culture after culture after culture after culture. Being in so many schools, had the opportunity, really, the privilege of learning about lots of different cultures. I'm no expert, nor are you, right? But we have to find out about culture. Like if you're, let's say you're working in the rural community, you're working with migrant farmers, and you assess that the majority of them are Mexican or Hispanic, right? What do you want to get to know about their culture, right? Because you're in charge of their care, right? You ask, you research, you participate. And that goes with any culture. I had to do that. It seemed like every fall I came back to school, and one of my schools, there was a different group of students of a new culture that I was unaware of. So then I went on the learning curve to learn about that culture and to find out if there was anything with regards to the kids in the school that needed to be addressed with the teachers, food services. So it's a lifelong learning opportunity for us in nursing, right? We do not treat every patient as we would like to be treated because our cultures can be vastly different. You know that old saying, treat everybody like you want to be treated? Be careful, because different cultures may be so different that no, that's not the way I want to be treated. All right. So as we work through our nursing profession to attain cultural competence, okay, when we finally can attain our cultural competence, right, we are making a conscious attempt to learn about people from all different cultures. And most importantly, we are looking through, we're looking at their worldview through their eyes. Okay, it's kind of like, I think I said last week, we talked about evidence-based practice. It's kind of like, do you work with somebody that says, oh, we've always done it, we've done it like this for 30 years, we don't need to change anything, even though new evidence suggests that doing it a different way is going to improve patient outcomes, right? Does anybody work with people like that says, don't worry about it? Nobody? We all work with somebody like that, right? Well, it's also true with cultures. Sometimes it's hard to incorporate cultural beliefs and practices into the health plan of care because they seem outrageous or they seem incorrect or we don't believe in them. That's not an option. Cultural competence means we incorporate as much of their culture as we can. So there is another kind of community nurse. I think we've got a school nurse, an environmental nurse, an occupational health nurse, immunization nurse, and hospice nurse, home health nurse. We also have a faith community nurse. The faith community nurse, just real quickly, is somebody who is hired and works within the congregation, whatever the religion is, right? Whether it's in a church, in a building, in a mosque, in a temple, doesn't matter. Okay. There may be a faith community nurse that works in a particular religious organization. Okay. The one thing to remember about faith community, I actually have a couple of girlfriends who are faith-based nurses. So I know a lot about what they do. They are really community nurses, but add the spiritual aspect. Right. So they're working, whatever their religion is, they're working with a congregation that practices that religion. Okay. So whatever the goals and focus of that congregation want you to have, you will have it. It looks different everywhere.
So are they
You know,
they're more
what?
so they're holistic nurses?
Holistic nurses, adding spiritual, yes, very primary focused. Maybe they're doing a lot of education on how to prevent getting pregnant, maybe they're holding group grief sessions for clients for people in the congregation who have lost loved ones. Okay, it's a community oriented role, right? Where they're looking at the whole congregation, right? They're trying to incorporate spirituality into the practice. They may be volunteers, they may be paid by the church, but they may be the ones out doing the visits with the new mothers, the new teen mothers. They may be going out and sent out to visit somebody to do a home visit and add the spirituality prayer aspect with the person, the client. Right. So what they're primarily focused on: health education, health promotion, coordination of community resources, right? While incorporating spiritual and religious practices. And again, this is for anything, whatever your religion is, wherever it's practiced. Okay. And like, was that Keturah? Oh, Charbel said, focus on holistic body, mind, and spirit. Okay. Religion reflects tradition. We talked about that. Spirituality is individual's attitude. So there's two terms: religiosity and spirituality. Spirituality is the big picture. This is whatever your attitude is related to a higher power, how things all fit in the universe spiritually. Where religion, it's really limited to whatever your religious tradition is or your denomination is. So that's the difference between religion and spirituality. Okay. Incorporates chaplain or spiritual advisor. That's another role. And then we talked about that. Why is God punishing me? We talked about that question. Okay. Ethics. Let's talk about ethics. One of the first things, first of all, let me just say ethics. We face ethical decisions in our life multiple times every day, right? Ethics is about doing good, doing the right thing, doing good. So we face ethical decisions every day, whether it be with our family, nursing school, your job, your community, right? You're always facing ethical decisions. What's right versus what's wrong. Right? But in order to talk about an ethical, let's say you're sitting on an ethics committee or you're having an ethical discussion, there has to be an issue to talk about. Okay, ethical decision making is a complex process, but all the big organizations, everybody is ethics committees where they look at certain ethical decisions about care. Okay. So we need to know about our ethical theories and our ethical principles. And that's on the next slide. Okay. I mean, ethical things that come up, think about it. End of life care, abortion versus adoption, end of life treatment care. Think of all the transplant lists. Who goes on them and who doesn't go on them? Think about all the issues that come up during COVID. Who gets a vent? Who doesn't get a vent? Who gets a hospital bed? Who doesn't get a hospital bed? Who gets to go to surgery? Who doesn't get to go to surgery? Right? So some of our ethical principles that, think about it. Just think of something that you've dealt with recently. Right versus wrong. These are all the things you experience, our principles. Moral distress, beneficence, do good, advocacy. We are advocates for our clients. That's our ethical responsibility, to be an advocate. Autonomy. It's our ethical responsibility to give clients as much autonomy as we can. We don't want to be making decisions for them, telling them what to do, right? Non-malfeasance, do no harm. Utilitarianism, deontology, those are theories. Don't worry about those. Okay, these are theories, but you can read about them. Utilitarianism, where the ends, where are my notes on utilitarianism? Hang on. I don't want you to focus too much on these, but let's talk about these. I don't think I have. Oh, utilitarianism right here. Okay, it's utilitarian, focused on the outcome. All right, trying to do the greatest amount of good for the least amount of harm, with the least amount of harm. Right? Feminist ethics, virtue ethics. Virtue ethics based on ethical decisions, virtues, your virtues. Virtue ethics is based on ethical decisions on character. Okay, virtues, you're looking at benevolence, trustworthiness, integrity, conscientiousness, compassion. Two things I want to bring up while I have my notes pulled up. A couple things about nursing documentation. Nursing documentation has to be factual. This falls under the ethics topic. Legal nursing issues, documentation, factual documentation. It has to be objective. Descriptive, objective information about what you see, what you hear, what you feel, or what you smell. It has to be supported by factual data. Okay? If it's subjective, it may be misunderstood. Right? So you can't say, oh, the patient seems to be in a lot of pain. The patient appears to be grumpy today. The patient seems happy today. No, you have to say it has to be factual information. On a scale of 1 to 10, what is your pain? You've observed a wound the wound dressing to be dry, intact, the skin to be intact, right? That's factual. Okay, you can't state your opinion. That's not what documentation is. Then the other thing, another legal, ethical nursing issue that comes up is floating. Typically, unless you're protected by a union, floating is an acceptable practice. Anybody ever not been floated to another unit that you have no clue about? Everybody's been floated, right?
Yes.
Yeah. Right. And we're floated for a variety of reasons. We can't refuse to float. Unless, of course, we're part of a union that we don't do that. Right? But what do? Right? We know that we are not competent to care for a pediatric trach patient. However, on that floor, what could we contribute? Can we restock linens? Can we deliver food trays? Can we clean rooms or whatever? What can we do? Right? So yes, you have to float, but what you would have to have a discussion with whoever the leader was on that shift that you're going to, what could you do? What could you do safely? Because remember, you're working under their license and they know that. Does that make sense?
Yes.
Okay. Go back to my PowerPoint. American Nurses Association. Okay. I want you to understand this. Okay. If you get a question about the American Nurses Association, what is it? What does it do? It formulates general standards and guidelines for nursing practice. Think about it. American Nurses Association represents nurses in America. All right. They do general standards. This is in your PowerPoint, general standards and guidelines for nursing practice. They're broad and general, and they apply across the nation. And then when you get into the state nurses association, that's when it gets a little bit more specific with scope of care. Okay. I want to make sure I covered all my notes here. I know we talked about hospice. You guys know about stages of grief. We talked about that. Therapeutic communication. We talked about that. Faith and spirituality. We talked about that. Cultural competence. We talked about that. Legal and ethical issues. Yep, we covered all that. Okay. We're good. I know we covered a lot of content. Do you have a better understanding of some of these concepts? Okay. Do you guys want to try the oh no, actually, because we have to finish 10 minutes early, right? So that would get us at 4:40, right? That's 10 minutes early, right? Because we don't take a break. So I'm actually early today. However, you do have a Kahoot, a really good Kahoot. Okay. And I put that in the chat. I thought we might have time to do that. We don't. But Kahoots, as I've told you, are always fine to be done on your own. Right. And so this is the Kahoot. It's in your announcement, your week 4 announcement. Okay. So I would do that. It's a week 4 and 5 review. It's good. Okay. Remember, next week is exam review week already. Right? Yeah. Next week is week 6. So pull up your schedule and look at the 3 reviews. I think they're in the same days and the same times. So you have a Monday review early in the morning, Friday night review with me, or evening. I think it's 6 o'clock Eastern. And then Fred Kershaw does one on Sunday nights. We had I had great attendance at my review Friday at 6 p.m. I had over 20 students. It was fantastic. So next week is review week. Okay, and of course you'll get the recordings like you did last time. And I think next week is week 6, so you're going to have we're going to have 2, 3. We'll have quiz 4 next week, right? And that will only cover week 6, right? Because we just did 4 and 5. So next week's quiz will only cover week 6. You have reviews next week. It's week 6 till you have an NCLEX. Right? Weeks 3, 6, 9, and 11. So you have reviews to go to if you want, if you can. NCLEX. We'll have a quiz. There was one other thing. You're working on your group assignments, right? Thank you. I'm glad you all are. Thank you. Because they're going to be due soon. Okay. If any groups are having issues, let me know. 2:38. So I'm going to give you guys 2 minutes of, what did I call it? Give back time. What's that? One couple of minutes of give back time.
All right.
It's good to see everybody today. I will see you next week. Reach out if you need any.
We just need to watch these videos for the hospice for week 5. We don't have nothing to turn in for homework.
NCLEX.
But it's
NCLEX. Well, I mean, I'm just reviewing what's in your, I'm just looking ahead for you guys. Read your week 6 module. You're going to have a quiz. You're going to have an NCLEX. Look at your master review schedule because you have 3 exam 2 reviews coming up. So you can go back and you can go back to the exam 2 review concept guide I sent you last week. You can fill in weeks 4 and 5. We just covered it. Next week is week 6. That help?
Can I speak with you?
Yep. Just stay on after. Does anybody have any questions that will benefit the group?
So
Okay.
week 6, okay, no. Week 6 is the quiz review. I mean, for the quiz, right? Or what we already
Yep,
done.
look in your module. It's quiz 4. Week 6 is quiz 4.
I'm saying, what is it covering? What we went over today?
Oh, week 6. No, week 6.
Okay, week 6.
What we
okay.
did today covered the quiz we took today. Just
Okay,
week 6.
got it. Okay.
Anybody else have any general questions that will benefit the group? All right, it's good to see everybody. I hope you have a really good rest of the week. And reach out if you need anything during the week, okay? And then if you want to stay on, if you need to stay on and ask any questions, I'm going to stop the recording. Just stay on.
Thank you.
All right, good to see everybody.